Ever thought that being a stickler for cleanliness or a perfectionist is synonymous with having obsessive-compulsive disorder? Well, it's time to debunk that myth. OCD, short for obsessive-compulsive disorder, is not a characteristic or a quirk, it's a disorder. A mental health disorder that is characterized by unreasonable thoughts and fears, known as obsessions, which lead to compulsive behaviors. So a penchant for tidiness or an obsession with symmetry doesn't necessarily mean you have OCD. It's much more complex than that, and it's important to understand the signs and symptoms in order to identify it accurately. Firstly, there's a fear of germs or contamination. This is not just a dislike for dirt, but an overwhelming fear that can lead to excessive cleaning or hand washing. Secondly, there's a fear of forgetting, losing, or misplacing something. This goes beyond the usual forgetfulness we all experience and can lead to behaviors like excessive double-checking of things, such as locks, appliances, and switches. Thirdly, individuals with OCD may have a fear of losing control over their behavior. This can manifest as irrational fears of acting on an impulse to harm oneself or others. Additionally, aggressive thoughts toward others or oneself can be a sign of OCD. These are not just occasional flashes of anger, but persistent, unwanted thoughts that cause distress and can't be easily dismissed. Lastly, unwanted, forbidden, or taboo thoughts involving sex, religion, or harm can be a symptom. These thoughts are intrusive, unwanted, and cause extreme anxiety. Now, the good news is that OCD can be treated. Psychotherapy, specifically cognitive behavioral therapy, has proven to be effective. Medication, prescribed by a psychiatrist, can also be a part of the treatment plan. So if you identify with 2 or 3 of these symptoms, it's crucial to seek professional help. OCD is not a personality quirk or a badge of honor. It's a disorder that requires understanding and treatment. Remember, there's no shame in seeking help. In fact, it's the bravest thing you can do. So, take that step, reach out to a professional, and start your journey towards understanding and managing your OCD.